is Autism Acceptance Month, and there is a local program that is doing everything it can to support children with autism.
Autism Care Therapy offers therapeutic services that improve the quality of life for our children and prepare them for a better future.
Andrea spoke with owner Shadin Kassar about their specialized care.
I feel like from a very young age, I've always had the love and compassion for people with special needs. Very early on, I would go out of my way to show extra niceness and to show a higher level of respect for people who would otherwise not get the same level of nice treatment and respect as other people. So I feel like that was the basis, the foundation, the program that God installed in me to prepare me for my mission in life. And then the cherry on top was that God gifted me with a child on the spectrum, my oldest child, and that drove me into the whole autism ABA world.
You speak about this with such passion. Is that what drives your passion, your child, and just your love for helping others?
Yes, definitely. My son, and then, like I said, I've always been very compassionate with people with special needs or people who are weaker in the society.
What sets Autism Care Therapy apart from other organizations?
I feel, it's a purpose-driven organization, so we have a purpose and a mission to serve people, especially those in underserved community or people who don't have access to care. And then the second thing is we don't look at the child as one person. We're not treating just the child, we're supporting the whole family. So we view the family as a unit in the society that needs support, not only the child. And I think that's what makes us more flexible with the parents, very accommodating, we try as much as possible to engage the parents, engage the society. We try as much as possible to collaborate with school and other therapies, because we just don't want to teach the child the skills in the clinic. We want the child to use these skills that they learn in the clinic outside at home, at school, and then out in the community. So we also have a community support program that service kids even outside in their natural environment, in the home, at mall, like in all the other community setting or the natural environment of the child.
You're a very hands-on parent, which is so wonderful. So talk a little bit about how crucial it is to involve the parent, the guardian, and the community too, because that's a big part of what you do.
Right. We're not working with a child, period. We're working with the whole family. We're trying to support them. So we want to make sure that the child is doing great with us at the clinic. We want to make sure that he's also doing great, or she's also doing great at home, in the school, out in the community. So it's very important for parents to attend these parents training. I know all of our supervisors and all of our clinicians, they're super awesome, God bless them. They all go above and beyond into supporting these families and making themselves available to them when they need it.
I think that's wonderful. And early diagnosis, you always say, is very important.
It is.
Kind of walk me through that. When to test, when to figure it out, what should a parent or guardian do?
I mean, early diagnosis is the best thing they could do to their child, because when we get a kid who's like 1.5 or 2 and work with them from very early on, from very young age, versus if we get a kid who's 14, the progression, it's going to be vastly different. Obviously, the kids who start at a younger age progress more, earn more skills, and learn more stuff. So it's very important for the parents to keep their eyes open. If they think something is off a little bit, or if they have any concerns, I think they shouldn't shy off and they should address it. One helpful tip would be to go online and download the mChat. As a married chat, as like we're chatting, C-H-A-T.
Okay.
It's a free one-page PDF that they can download from the internet. It's free, don't pay for it. It has 20 questions. Read these questions. It will, even if you don't answer and score, that's fine, but it will help the parents guide their thinking into what I should be looking into. So for example, if the parent is like looking into, does the child follow my gaze when I point? Do they follow my finger? Do they try to, if I'm looking at the child and if I'm looking at you right now and I look at there, naturally you should look where I look, right? It's to the child is that. And then most parents don't understand or don't know that a 16, a 17, or a 20-month baby should be able to do these things. So the MChat will bring these things into their awareness. And if they still think there's a concern and would like to take it a step further, they can call us, we can help them, but they can on their own find a place that does a comprehensive diagnostic evaluation to either confirm or rule out possible autism.
Wow, that's interesting because diagnosis and treatment too, it's different for different people, on different parts of the spectrum, but also different ages, right?
Right.
That makes sense.
Right, so the earlier they start, the better it is. And obviously different goals, different targets, depends on the age and the functioning level of the child.
For more information about Autism Care Therapy, give them a call at 8555-AUTISM or visit autismcaretherapy.com. They have multiple locations across Chicagoland. You can see them right there on your screen.